Welcome to today's webinar, Getting the Information and Resources You Need for Childcare Recovery and Stabilization. As New Hampshire's childcare systems and programs transition from emergency to recovery and stabilization, providers will need the information and resources in order to serve children and families in a safe and healthy environment. This part of the webinar series is our final session. Within the series, we'd like to welcome you to this session. Please note that today's session is an hour in length. Today you'll be hearing from the following: the Department of Health and Human Services update with Marty Ilg, Deputy Director of the Division of Economic and Housing Stability, the Council for Thriving Children with Director Christina LaChance, Deborah Nelson with the Bureau of Child Development and Head Start Collaboration, the Child Care Licensing update with Melissa Clement, Chief Child Care Licensing Unit, the Bureau of Child Development Head Start Collaboration update with Diane Chase, Assistant Bureau Chief, and Krisha Dubrio, Program Specialist, an update from Child Care Aware of New Hampshire Program Services with myself, and then a question and answer period will be followed with Emma's assistance. First, we'll hear from our Deputy Director, Marty Ilg, on the Division of Economic and Housing Stability. Welcome, Marty.
Thank you. For those who don't know, child care is housed within the Division of Economic and Housing Stability here at the Department of Health and Human Services. And the mission of DHHS is to advance the health and economic and social well-being of individuals, families, and communities. And the vision is that individuals and families are strong, resilient, and thriving in their communities. The division, you can go to the next slide. The Division of Economic and Housing Stability includes the following: the Bureau of Child Development and Head Start Collaboration, the Bureau of Child Support Services, the Bureau of Employment Supports, the Bureau of Family Assistance, the Bureau of Housing Supports, and Comprehensive Family Support Services. For those who don't know, that means family resource centers, which we all love and hopefully are very connected to. So the work, you can go to the next slide, Jen. The work of DHHS generally centers around the desire for healthy, thriving communities. Childcare is certainly a very important part of this. And the attention is on things that families and children need to thrive now and for the future. Things like safety, food and nutrition, employment and income stability, health and well-being, housing stability, transportation, education, and environmental health. And as we continue to work towards our vision, we all continue to engage all of you in this work. Next up is Christina LaChance. Christina is the new director of the Council for Thriving Children, and she will talk a little bit about their vision of a coordinated system. Christina?
Hi there. Good afternoon, everybody. I'm Christina LaChance. Thank you so much for having me. As you may know, in January, the governor announced and signed an executive order establishing the Council for Thriving Children. That council, as you would expect through the COVID pandemic, took a bit longer to form than originally planned. So they did begin meeting in June. I think it was June. They had their very first meeting. They had a kind of get to know you meeting prior to that. And subsequently, I came on board beginning August 1st. So I am thrilled to be here. And I'm thrilled to be supporting both the Department of Education as well as the Department of Health and Human Services in collaboration with the governor's office and so many other departments. In terms of my vision for this council, I think it's safe to say I envision opportunities for us to work together across multiple different departments, divisions, bureaus, with children and families in mind and in the center of all we do, to move our policies forward in a way that is innovative and and really supports children and families, starting prenatal really, through their school age years, their early school age years, third grade. And so with that, I'm also careful to say that my vision is evolving and will evolve as I get to know people. I've just come on. I certainly don't know everyone on the council yet. And I do plan to meet with each council member one-on-one to hear more about their vision and what their hopes and dreams are. And then certainly as I'm meeting with the commissioners and deputy commissioners and others and parents, children too, really understanding what their hopes and dreams are for our system in the future. So I'm thrilled to be here. I'm happy at the end to answer questions if that's appropriate. But I do look forward to getting to know many of you if I don't know you already. I'm looking forward to our next meeting. There'll be an announcement about that. It should be the day after Labor Day. We're just making sure that all of the schedules line up. And again, I look forward to perhaps coming back when I have a little more time under my belt and can provide some updates on what the council is doing after I've met everybody. So thanks.
Thank you, Christina. Our next speaker is Deborah Nelson, the Bureau Chief of the New Hampshire Department of Health and Human Services, Bureau of Child Development and Head Start Collaboration.
Can you go back a slide, please, Jen? Thank you. So hi, everybody. So our Department of Education partners are really eager to be working hand in hand with all of us to think about ways to address jointly and collaboratively the emerging issues that you are all seeing as schools develop their plans to reopen in New Hampshire. We know, the direct impact that's having on many, if not all of you. Unfortunately, Christine Brennan was not available today. She's down in Massachusetts, and her staff are out straight trying to support schools with their, the development of their plans. But she did ask that I share a resource on their behalf, which is a new guide that they issued that you can see a picture of in the corner there. New Hampshire Grades K-12 Back to School Guidance. It's chock full of great information given to schools as a guide to help them as they design their plans to physically reopen schools and or create their hybrid models for remote learning and on-site learning. So that this guide has 10 recommendations that really emerge from the work of the School Transition Reopening and Redesign Task Force that was charged with taking a look at, what schools need to think about and plan for in the face of COVID-19 and all the issues associated with that. So there are 10 topics in this guide, and the link is below, and I hope you'll take a look at it when you get a chance. But the topics range from everything from developing district management and communication response plans, following DHHS public health guidelines, all the way to physically getting the physical environment prepared and supporting student wellness, and looking at their policies for, for example, transportation, planning for meals, how are they going to get meals to students, dynamic instruction, and professional development. And several of those topics could have direct implications for all of you as we figure ways to work hand in hand with the departments and with schools as they create their plans. And a particular interest to you may be the section on school building use for non-school functions. I know a number of you count on having your after-school programs in school buildings, and some schools are saying, well, we're not going to open the building for that purposes, but you may be interested to know that the Department of Ed's guidance says on-site after-school childcare for students of each particular school may be considered and should follow district protocols, additional state guidelines for childcare, and New Hampshire DHHS childcare licensing rules. So they put that right in there, so you have an opening to call your district if you have a program in a school, or that's where your school is located, and say, hey, DOE says, we should be talking about this. What can we do together? This is a joint issue for your students and their parents and us. So They also provide, Christine also shared another resource. You'll see the link on the bottom left under this beautiful child, which is a list of school district plans that they have in hand to date. And she talked about how each district is deciding about in-person, hybrid, or remote options for reopening. And their plans are still being approved by school boards. At this time, the DOE currently has 45 school reopening plans in hand and on their website, including 35 school districts, 6 charter schools, and 4 non-public schools. So you can click on that link, when you get it, and you can, or just go to the DOE website directly and take a look and see if the school districts of interest to you have their school reopening plans approved and posted as yet. And if not, I'm sure they'll be up, shortly, as September is quickly approaching. So Christine also wanted me to invite you, if you have questions specific to the department about partnering with school districts in your role, to send them to us, or you can post them in the chat. I'll collect the questions with Emma's help, and we'll send them over to Christine and her team and get answers as much as possible and get them back to you. And also, she's open to arranging another time where, if we want to just do a specific webinar or together, or a session, a Zoom meeting where there can be Q&A about that topic. She's open to that as well. So put your ideas in the chat, or send me an email. Lastly, I just wanted to remind you all, I know there's so many resources available to you, but one, I think, of the more amazing resources available to all of us is the ECLKC, which is the Early Childhood Learning and Knowledge Center, which is a national resource from the Office of Head Start, which also works in partnership with the Office of Child Care. And they just have amazing resources related to anything and everything early childhood and learning, but especially about COVID-19. And one that I was particularly interested to see and wanted to make sure to share with all of you today, their latest resource is called Helping Children Thrive During the COVID-19 Pandemic. They called it they're doing these training camps for Head Start, Field, and others. And I hopped on one of the training camps with that topic, and it was just excellent. So I will share the link. It'll be in our notes that come with the webinar information, but that talks about, it has lots of suggestions like managing stress through mindful moments, storying, like sharing, helping children to understand issues and to address their concerns and fears, like storing. There's a story called the germ that wears a crown, a story about coronavirus, and there's lots of those kinds of examples. And then coping strategies suggested from our early childhood mental health specialists associated with Head Start and child care, that are useful for both families and children. So remember to check out ECLKC, and again, I'll be sure to post the link for that. And that's all I have. Thank you.
Thank you, Deborah. We're going to hear again from Marty Ilg, the Deputy Director of the Division of Economic and Housing Stability.
Hi, Jen, can you go to, there you go. Thanks for the segue, Deborah. So in my travels through our bureaus and with the work that we do with integrated teams at DOE and DHHS, I hear a lot of concerns about the school year. This is not news to anyone. We've been talking about it since June, I think. So from our lens, though, some of the emerging issues have some suggested solutions, and I'm going to talk about these with you. We hear that school-age families are very worried about childcare options for the fall. Well, this seems pretty simplified, but it's true, and we are continuing to work on all kinds of different options. This was part of a discussion with the Department of Ed in particular, and we were at the time encouraging parents to visit the Child Care Aware website, and in fact, their Commissioner of Education talked with all of the school superintendents, who then talked with their principals about using the website. So this was the recommendation from the Department of Education to all school personnel in the state. I haven't heard from Tracy Pond of late. Maybe Jen knows a little bit more than I do about whether it's increased traffic or not. But this was one of the places to start. In the meantime, we're having a lot of other conversations. Another issue is some teachers don't want their kids going to childcare in a different district. And I think that that could probably be expanded to employers as well. Just that you know, the more times you increase or cross your bubbles, the more chance of infection. It's one of the solutions that we propose is the idea of the pop-ups, which you may remember from the ECCP program. Right at when the governor first announced the stay-at-home order, childcare licensing established this certificate program where employers could sponsor childcare for their employees. So it's a really nice option. And we actually have had a lot of people take us up on this. During the height of the emergency, it was more hospitals and long-term care facilities. And now we're seeing a number of districts, which is wonderful. So schools can set up childcare and remote learning for their employees' children. And all they really have to do is contact childcare licensing to do this, and they will walk them through the process. Something else that happened just a couple of days ago is that the Business and Industry Association, which I love to hear, is sort of getting on board as well. And I think Childcare Aware of New Hampshire and maybe the Bureau or childcare licensing is going to be meeting with them and perhaps even doing a webinar for businesses on some of these things, pop-ups and other types of arrangements. If you want to go to the next slide, Jen. Another emerging issue is that families are setting up childcare co-ops with friends and neighbors. This is sort of an old idea that's becoming popular again. And we've kind of struggled with, you know, what does that mean for us? What kind of obligation do we have? And lo and behold, Childcare Aware of New Hampshire already has a resource guide to help with this kind of care. And I put you can find it on the Childcare Aware website, and the cover of it looks like the photo that you see down in the right corner. And I would encourage folks to go there. Another issue is that parents will need a lot of flexibility in their work schedules to accommodate the various and varying school schedules while they continue to work. And something that we've simply been saying is that ask your employer for this type of flexibility. I mean, I know here at the Division of Economic and Housing Stability, people were given schedules this summer to accommodate these childcare co-ops. It doesn't hurt to ask. This is something that we also discussed with the Business and Industry Association, and also Tracy Pond and I were part of a national call with the TA for Childcare Aware of New Hampshire, and they are working with the Chamber of Commerce of America to put out some kind of a statement talking about, you know, employers need to kind of help out here and adjust schedules where they can. A couple other things that have just come up but didn't make the PowerPoint is that the Office of Child Care has issued guidance about child care scholarship payment for full-time for school-aged children who are in child care. The clarification here is that CCDF can be used for payment of caregiving, but not the actual instruction. And there's some fine print related to that, and we will have more information on that later. What we're doing right now within the Division of Economic and Housing Stability with the Bureau of Child Development is we're working on some cost models. Going to find out how much it costs. We haven't done it before. And we're also working quite diligently on the ability to waive a policy for absentee payments due to COVID. This had come up, I think in the previous webinar, it came up related to actual closures of program, But now we're wondering about absentee payments for children due to COVID. And we have some details that I think Krisha might talk about a little bit later. Anyway, more to come on all of that. But we just mainly want you to know that it is on the radar. It is under construction, so to speak. Thanks. And I think Melissa's up next.
Thank you, Marty. Yes, our next speaker is Melissa Clement, the unit chief for the child care licensing.
Good afternoon, everyone. Okay, so someone created a slide. Cool. I love it when people do this stuff for me. So as you are aware, most people, I think, we also, I sent out an email yesterday around how many, the change to the group size as announced by the governor last week. The guidance as written in the child care public health says 20 people total, which includes children and adults. Now, as you can see, if you're looking at your screen, it changed from 10 to 20 under number 2, but the example itself in the parentheses does not reflect the actual 20. It's still reflecting having 10. So we know that the intent is that the group size is now 20 people total instead of 10 in a room. The guidance itself may not all align with the examples that were given, and then there's another part to this somewhere else in the document that doesn't quite align with the 20. But please know that you can go forward with having 20 people as allowed by public health. For my purposes, seeing that I'm child care licensing, I just needed to remind you, and as I sent out in the email, that you would need to make sure you are still abiding by your ratios, your maximum group sizes, because you can't have 20 or 18 or so infants in a room. You're still required to abide by your child care licensing rules regarding group size, but if the group size by child care licensing rules allows for up to 20 people in that room, then that is what public health has determined the change could be from 10 to 20. So just wanted to make sure we got that word out there. I also know that the governor's office is being reached out to regarding this, in case you're hearing about that, because the press conference last week indicated that it was 20 children, not 20 people. So there could be further clarification on that, but for right now, we are going with the guidance as posted by the governor's office, and the link is there on the slide. So that is what we have. So I just wanted to provide some additional clarification there. The other topic to expand a little bit beyond what Marty was talking about, we at Child Care Licensing are looking in our legal department and the department itself are looking at what our regulations are for these additional types of programs that are popping up or wanting to provide care for school-age children in lieu, like for helping with virtual learning. We are looking to see what our statutes require of us, what we can do to facilitate this care for parents and families that need it. And I did see a comment in the chat that came up. We are certainly, and Child Care Aware is certainly pointing parents towards licensed providers that already exist. However, we also know that it may not be enough because you guys can't magically expand your space. So although if you have space and you're willing to take more, that we are certainly, Child Care Aware will certainly be using that information and, as always, sharing that information with parents. There may be, depending on where you are in the state, a higher need. Employers, the employer pop-up programs that Marty spoke of, that was part of the governor's executive order very early on in this. That happened back in March. So that is under the governor's executive order that we allow for employers to create pop-up childcare program for their employees. And we have guidelines for them for that. It's with the state fire marshal's office. There are still some safety procedures in place, but that was allowed through the governor's order. So that's not something the department created. It's something that was expanded through the governor's office and that we're facilitating. We know all of you out there must be thrilled with the change in the group size for 20, and we really hope that assists you, and we hope that it means additional spaces for families as they're looking, and we're here to support you in that. A reminder that we have, if you are taking school-age children who will be there all day, please submit a waiver to the department so that we can issue your approval for having children in care more than 5 hours, as that's what the statute requires. We have a quick turnaround process for that because we have a standard template. I also want to encourage you to, if at all possible, not apply for that until you know you need it. We know some families haven't decided yet. We know some school districts may haven't decided yet. So if you don't think you're going to need it, please don't send it to us, because we are processing so many of these, and it would certainly help us if we are only processing those for the ones who need it. Definitely, we can certainly turn these around very quickly if you find that you have that need. And there's no one's going to be denied the ability to have school-age children in their care for more than the 5 hours. So there's not a need to get this done quickly. Someone just asked, school age, does that include kindergarten age? School age is any children who would normally be enrolled in a full day school program. So if you have children that normally would have gone to kindergarten full day that are now in your program, you should be applying for that waiver so they could be there all day. The only other quick update I have from childcare licensing is my apologies if I mentioned this on the last webinar, and I'm not quite remembering if this came up, but we have learned that the Department of Safety has opened up fingerprint appointments. So you can call them and get fingerprints. You are still not required to do so because that emergency order is still in effect. However, if you have new staff coming on and you want to complete the full background check process now, we can go back to doing the fingerprint appointments. You just need to call and make that appointment and submit that information. So again, that is not required yet that you do the fingerprints. However, if that is something you want to have your staff do, then by all means you can do that. And I just wanted to let you know that. And from here, that's it for childcare licensing. Thank you so much for everything you're doing. Thank you for the warm welcome that you are giving our licensing staff as they're going out in the field and seeing some of you for the first time in a while. We certainly appreciate that, and they're very excited to see you and see the good work that you're doing. So thank you again.
Thank you, Melissa, for the update. The next on the agenda is the Program Specialist, Krisha Dubrio from the Division of Economic and Housing Stability, Bureau of Child Development and Head Start Collaboration.
Thank you, Jen, and good afternoon, everyone. Thank you for inviting me this afternoon. I am here to speak to you about the new changes that were implemented on August 3rd regarding the changes to the New Hampshire Child Care Scholarship Program, specifically related to the new absentee hour allotments that were released on August 3rd. And can you just forward the slide one? There we go, thank you. So now a child eligible for New Hampshire Child Care Scholarship will receive a new absentee hour allotment. And on the first Monday of every month, a new allocation of absentee hours determined by the child's authorized service level will be granted to the child. This new monthly absentee hour allotment is designed to stabilize childcare payment where the child meets their full authorized service level at least 85% of the time across a year, and the childcare provider itself is paid at that authorized service level. The goal of this new change also is really to support families and really less out-of-pocket expenses for the family. So we know that these are new changes that are coming your way. Just know that these are not changes that we've been working on these changes for a long time. They've been tested a lot. We're working on these. We're here to work through with all of this with you. This is new policy. We know that, and you have a lot being thrown at you right now. However, we do see this as a change that's really going to support both the child care provider and the family. We'll move to the next slide, please. Thank you. So here we go. Here are the new absentee hours allotment that are going to be renewed every single month on the first Monday of the month. So that a child that is authorized for full-time care, which is 31 hours per week, will get 21 hours of full absentee hours. If a child is authorized to attend half-time, which is 16 hours per week, they are going to get 13 absentee hours per child. At a part-time service level, there are no absentee hours that we are giving them. And that is just simply because if a child attends 1 hour, they're going to get paid at that part-time service level rate. So they don't need any absentee hours. As long as they attend 1 hour, they're good. They'll get paid at the absentee hour rate. To help further understand how many additional hours these children will now be getting, if the child is authorized to attend a full-time, in the old system, prior to August 3rd, they were given 62 absentee hours in 1 year. Now, in the new system, and they would run out of those hours, and they wouldn't get renewed until until January 1st of the following year. Now, if a child is authorized for the full time, they will get 21 absentee hours on the first Monday of every month. And over an entire year, this child now will be allowed 252 hours in a total. So that is a big difference that we're increasing these hours. So that's a really huge difference for families. And I just want to, that's hopefully helpful to all families as well. Okay, we can move to the next slide. Thank you. Providers are still required to bill weekly on web billing. The billing invoice should include the child's present hours and absent hours. It should be based on a child's typical schedule. So if a child is typically enrolled 3 days a week, 4 days a week, yet they're absent 2 of those 4 days a week, and they would typically attend those 4 days a week, then bill whatever that present and absent hours that they attend. The system will automatically calculate what the child gets paid for the service level. It's calculated based on the number of present hours the child attends. So basically how it works, if there are enough absentee hours available for the child, the system will only use enough absentee hours to bring the child up to their authorized service level, and the child's full authorized service level will get paid. So for example, a child is authorized for 31 hours to attend full time. The child care provider bills 29 hours present, 10 hours absent. As long as there's absentee hours available, the system will pay only 2 absentee hours, not the 10 that the child care provider billed. And so to bring them up to that 31 hours, they were present 29 hours, they need 2 more hours to get them to that 31 hours. And that's what the number of hours that that the system will use. If there are not enough absentee hours available to the child, the system will not use any absentee hours, and the child care provider will be paid at the service level determined by the number of present hours billed. The service level will drop, okay? Remember, so for example, if a child is present, again, that same child, authorized to attend 31 hours, which is a full-time rate. They only attend 12 hours that week. They bill 12 present hours, but the child is absent 20 hours. There's not enough absentee hours available for that child to be brought up to meet that 31 hours. So what will happen is the system will look at those 12 hours that are billed and will pay for those 12 hours that the child was present, which is a part-time service level. The parent is responsible to pay the child care provider the DHHS the cost share for that week, plus any co-payments as the child care provider chooses to charge the family. So if there's a difference there, the family is responsible for that payment. At the end of the month, there may be absentee hours remaining in the bucket. Those absentee hours will not be carried over into the new month. Instead, the system will give each child a new absentee hour bucket according to their authorized service level. Okay, so it'll get renewed every single, the first Monday of every month. And this system is built, again, as I said on that first slide, the new monthly absentee allotment hours is designed to ensure the child meets the full authorized service level at least 85% of the time across an entire year. And the child care provider is paid at that level. So there will be some level where there will be some times that child does drop in their service level, but the goal is over a year span that child will get paid at that authorized service level at least 85% of the time. Next slide, please. Okay, yeah, so the new absentee policy, we're aware right now, and I think Marty had already addressed this, that with the new absentee policy, we do not allow payment if a child does not attend in an entire week. So if they're absent all week long, we will not make, DHHS will not make payment. Child care programs are seeing an increase of absences right now. We are very aware of this issue. We are in the process of exploring temporary policy change due to absentee of COVID-19 if a child drops in their service level or if no payment is made during that week. So we are definitely looking at this. We're working through this. We will be sure to get more information out to you as soon as we possibly can. We just want to make sure we're looking at all of these and making sure we're supporting you in the best possible way that we can. And lastly, one more slide. Registration fees, which we've already sent information out to that, but just want to reiterate and make sure you're aware, DHHS now allows payment for one child per registration fee up to $50 per calendar year. The registration fee charge must not exceed the amount charged to private paying families. And if the child care provider charges the family more than $50, the family must pay the difference. Just important to know, the registration fee is linked to the child. So if the child moves from one child care program to the next, and the first child care program charge the $50, then if it goes to the new child care program, that new child care program will not get paid. It gets renewed the first of the month, 1st of January every year. So that is all I have. I can see lots of questions that are coming through and I haven't been able to look at them. So I'd be happy to answer questions, maybe not now or at the end of the session.
Prisha, I just want to pop in for a sec. And yep. We do have some clarification on runny noses. And I believe there's a letter that's going out either today or maybe Diane is indicating that it already went out. We needed a little bit more information about, Lisa Ramphis says she already received it. Okay. So you all will receive, we're calling it the sniffles letter. And it is, it just breaks down, if a child has a runny nose that is new or unexplained, then they have to follow the CDC guidelines. If you have a runny nose because of change in temperature or spicy food or allergies or some other chronic condition that's been documented, then that is not new and it is not unexplained. And I think the letter has a lot more information, and this came from public health. So I just wanted to let you know that. Thanks. Sorry for interrupting.
Nope, I'm done.
And thank you, Krisha, both. Our next person up is going to be Diane Chase, the Assistant Bureau Chief from the Division of Economic and Housing Stability, Bureau of Child Development, Head Start Collaboration.
Hello all. If you want to click to the next slide. So I'm going to talk not in depth today because before I start, I'll tell you on next Wednesday, we are having a webinar exclusively dedicated to talking about invoicing and award funds and how to document them and what they can be used for. That'll be posted probably, Jen, later today to register for that on the Child Care Aware website. So please sign up for that. What I've been doing is accumulating your multiple questions and are putting that together in a presentation. We already have a short one that we've been using, but a lot of your questions are very similar. And the good news is a lot of you are making it more complex than it is. So I know that will be good news. It's a pretty straightforward compared to what I hear about many of the other programs like the PPP and things like that, which are much more complicated. So when we move forward, I'm going to give you a quick overview. First of all, how to determine what expenses. So one of the things I want to say right off the bat is when you get an award, many of you have already will be able to account for your funds, your award funds, and how they were spent by your losses alone. So let me tell you how this works. For example, if I make $10,000 a month in a program and I was closed April, May, and June, I've already lost $30,000. And let's say I got a $25,000 award. I can already count those losses towards our award expenses, document how previously, before COVID, I made that $10,000 a month. Now, true, if during that time you were partially opened and you got some, or you got some scholarship money, or you were partially opened, or you were charging parents anyway, even though you were closed, yes, you have to take that out of your losses. But for many of you that I've already spoken with, you've already accounted for those funds before you've even looked at expenses. Now, what can you do with that money? Once you've accounted for the money, that money is in your account to use in any other way in the program that you see fit. You've already accounted for it. So think of it in that sense as you're being paid back. So you're being paid back for those losses. And now that money's gone back into that account. So for example, I had a provider yesterday who didn't get paid for July and April at all because she didn't have the income from the months that she was closed. She can now turn around and pay herself. She doesn't have to put that salary in as an expense towards her COVID award because she's already documented it for the losses. What are some of the other things that you can do? For example, think about things that you regularly do. For example, you regularly buy supplies, toilet paper, gloves, let's say disinfectant wipes, but those have all dramatically increased in cost. They've also dramatically increased in the amount that you're using. So take a look at your previous expenses and what is the difference? It's a chunk of change. We even know that in our own households. What you paid for toilet paper in January is disproportionately more now than you pay, what you pay in August is disproportionately more than you paid in January. In addition, changes that you're making or expenses you're having as a result of COVID. For example, some of you have hired cleaning companies that you never had before to come in and do cleaning. That's a justifiable expense. You have staff working different hours. You have 2 staff in a room where you might have had only 1 staff person before with that group because somebody's cleaning all the time that somebody else is teaching. Those are the sort of expenses. We'll be talking about how to document them, but what I recommend is that you have your electronic file or a real file where as you run across these things and you have a question about whether expense or you're documenting it, put them in there, and then we'll be able to go back and look at those. One of the other things is that I'm very excited to let you know that we have a consultant coming on through Child Care Aware that's going to be able to be available to all of you for these specific questions to help you figure out programming pieces as well as the funding pieces. We'll be announcing her arrival and her role in next week's webinar, and so we're really looking forward to sharing that information. And let me jump to the next slide. So there's and refer back to the slide when it's posted, but there's some things that you that have to meet some or all of the criteria. I'm not going to go line by line. Take a look at these, and the big question that you're asking yourself is, has somebody else paid me in some capacity to do whatever work or for this expense or this income? And also, is this something that is somewhat irregular and beyond what we were doing before? So I harken back to January. What was going on in my program in January versus what's going on in my program now? They look very different. For those of you that have school age programs, not to worry, we didn't expect you to be open. But you've already had the losses of having your program closed in the fall, in the spring, but also you're going to have forthcoming expenses. You have until December 30th to utilize these funds or to account for these funds. We're just trying to get the billing out the door as quickly as possible and get the dollars to you. Jen, the next one. Thanks. Actually, I'm going to move on from this one and we'll go back. We'll talk about this next week because there's some things I don't want to go into in depth what you can and can't do. Biggest thing I want to share with folks right now is we really, really need you to get those invoices in. I know we've changed the dates on you a little. You don't have to have spent the money before you can submit an invoice. They changed the date. We changed the date on the distance between invoice 1 and invoice 2. If you haven't submitted invoice 1, please submit them simultaneously at this point because we'll just spread them out accordingly. The biggest thing I know that many, many of you are concerned about is, hey, I put in my invoice, where is my check? We want to assure you that your invoices, we don't send confirmations. And the reason we don't send confirmation that we received your invoice is because we have received, between our various programs, we're going to have received at least 800 invoices. So the idea that we could send a confirmation invoice to each one of those, I apologize, but that would be a time delay in getting them submitted. All but, I think, and Emma you can give me a nod if I'm correct, all but the invoices that have been submitted through today, from, what's today, Thursday, Wednesday and Thursday, all of the invoices prior to that have already been submitted to finance and are already in the process. They have to hand do every single one. They have to code them, document them, make sure that your vendor number is correct. And then if there's a problem, they kick them back to us, and then we reach out to you. But otherwise, they have to go through this very, very time-consuming process. Then they go to accounts payable. I don't know what accounts payable does, but they do their thing. Goes to one other office in the state, and then it gets mailed. Accounts payable did red flag for us, and I think I mentioned this last week, that the mail has been unbelievably slow. And those of you who have gotten your checks can attest to that. And so I think as the summer goes on, it's not going to get any better. I think it's going to be slow, but hopefully everybody will have gotten their anything that was submitted in July, ideally by Friday or Monday. If you have a problem with your invoice, or if you have a problem with not receiving an invoice, please shoot us an email and we'll do our best to find out where it is and in the system and where it's going. The second thing is that we've gotten a lot of inquiries about the round 2 funding. Just to let you know, we're in the process of finalizing what that's going to look like and when it's going to. It's really critical that you get your first award billed and invoiced before you could accept a round 2 award. So keep that in mind. And I think that's pretty much everything I have to cover, unless my colleagues see anything that they want me to jump out.
Diane, thank you. No, that was a great summary. I just wanted to add, for those of you who may be joining for the first time, or for those of you who've been on with us all through the series, and thank you for everybody for joining, is that we had initially, when we set up this CCRSP program, we had asked our colleagues in finance, what would be a reasonable turnaround time to expect checks. And what they gave us was, to the best of their knowledge, based on their experience. What none of us anticipated was that there was an explosion of demand to get invoices paid across the entire department. So not just us. We were told that our invoices have increased by 40%. So what we send over to them, that's just ours. You may remember that Marty shared that there are eight bureaus, Marty, in our DHHS division. And so everybody that got money for COVID related is sending all of the invoices through. So that was unanticipated by all, I think the entire department, because we're all new at this. Nobody's been through a pandemic like this. So now we're wiser in our estimates that it may take a little longer than we would hope, but given the resources that are in place, you know, there is the delay for which we apologize, but we hope that you will understand and just be patient with us as we do our best to work it through the system as quickly as we can. Thank you.
And I will add, if you want to jump to the next slide, Jen, I did include in this slide deck the process as well as how the invoices are done. And so those are mostly for reference for folks. I'm not going to go over all of them. If you can jump to the next one, Jen. And these are just some of the things, as Deborah was saying, that slow them down. So please take a look at this. Please take at the invoice reference, and please join us on Wednesday of next week, because we're really looking forward to it. We want you to feel less stressed and more comfortable with the knowledge around this award and how to utilize it, because we know you've got enough stress in your life right now.
Diane, can you repeat what you said about when they should join and how you were breaking up a little bit?
Mean for the webinar?
Yeah.
Oh, okay. So Childcare Aware is going to post later today the announcement of a Wednesday. What's next Wednesday? August 26th. Webinar from 12:30 to 1:30 next Wednesday that will be 100% focused on how to spend your funds, the invoicing process, and that whole topic, how to document it. And so you'll be registered on Childcare Aware for that, as well as we're taking your questions, both from today, but all the others that we get an email. We'll be utilizing that as part of the work for the webinar. I think that's, as I said, the other slides that I included were strictly for your reference, so you can move past those.
Thank you, Diane. I'm going to give a very brief update on some of the services being offered through Southern New Hampshire Services, Child Care Aware of New Hampshire. Just to let you know that our program survey is out right now. You can find it on the front page of our website at www.nh.childcareaware.org. If you haven't had a chance to fill that out, we do have it open until September 15th. If you're one of the first 200 programs to fill out and return the program survey, we are partnering with Sean Middleton to do a online Zoom storytelling. So that would be great for you to be able to be a part of that. If you haven't checked out our website, we are constantly updating it. The in-home guide that was mentioned earlier is already up on the site. The documents that they mentioned about the new updates and guidelines from the Bureau of Infectious Diseases are already up there as well. And I'll have the stuff that Diane was talking about up later today. And some really big news is our virtual annual training calendar is coming. We are hoping to have it released early next week. It's going to lay out all the things that we're going to be doing over the fall and into the spring next year. We're really excited to share it with you, and we can't wait to get it out. So thank you so much. And so now that concludes my update, and we'll go on to move on to some questions with Emma. And she's been collecting them throughout the presentation. Emma?
Thank you, Jen. Many of these questions have been answered throughout, and a lot of them are logistics about where we can find things. A big one that's coming in right now, Jen, is actually for Child Care Aware, and that's when will the sniffles letter be posted?
The sniffles letter that was sent out today has already been posted. It's on the recovery and stabilization page. It's on the daily updates page, and it's also under the provider resource page. So you can find all three things that were sent out by Diane or the EECCP team already posted on the site.
And it's, by the way, not called the sniffles letter. That's what we call it. It's called a public health update. So.
Thank you.
So if you're looking for sniffles, that's not it.
Diane, this question is about the grant money. Is there a distinction in accounting for grant funds received versus debt financing that has to be repaid, for example, the PPP loan or the EIDL.
I'm sorry, say that again, Marty. I mean, I only heard part of it.
I think people are just asking for clarification between the grant funds received versus the PPP or the EIDL.
Okay, I don't know about the EDIL, but I know about PPP. Those are, that was a loan with a forgiveness component. So you had to meet certain requirements and I guess work through your lender with the PPP in order to have that loan forgiven, a portion or all of it. I don't know how that worked. This is, our money is straight award money. It's grant money. We give you the money and you make sure you document how you used it, and it is yours. You're not repaying it. You're not giving it back unless for some reason, as it says in the provider agreement, for some reason you either don't want the funds, you can't use the funds, or you close prior to using the funds. And I just want to clarify on that one. That means a permanent close, and that you didn't have losses or expenses at the time of closing to account for the award amount, which so far that hasn't happened. And honestly, talking to all of you, most of you have taken such a hit. I think you're going to be fine with your award expenses.
Thank you. And then the other one that we have time for today is if a program has recently grown in size due to a new addition, since they have submitted their grant money, is there a way that they can apply for more grant money to accommodate for the bigger program?
What they need to do is, and a number of you have already done it, send into our ECCP mailbox. And when you say increase in size, it has to already be approved by licensing if you're a licensed program. Please send us a notification that you've had that increase. And I know a number of you were waiting on some expanding sizes or adding additional locations. So please send that in to us and let us know that the number of children that you're able to serve has increased.
Thank you. And just due to time, the rest of these I will collect answers to and send to Jen to be posted on Child Care Aware with the presentation.
Thank you so much, Emma, and thank you to all the speakers today. This is the last session, and we want to thank everyone who has participated and anyone who participated throughout the whole series for giving information and updates, and a special thank you to the providers who asked questions. We really appreciate it. To close, we'd like to remind you that to complete your evaluation survey and that this recording, this webinar was recorded and will be posted on the Child Care Aware of New Hampshire website at www.nh.childcareaware.org under the Recovery and Stabilization page under the COVID-19 tab. As a reminder, professional development hours will be provided to those who participated. Those registered through the New Hampshire Professional Registry, it should be up there. As long as you make sure you put your first name and last name and the name of your program in the chat box. And you should see it within 2 business days on your training transcript. If you're on the webinar and you're not an early childhood provider and are not within the New Hampshire Professional Registry, you can request documentation of your participation by emailing Donna Lake at ccrrtraining@snhs.org. For those participants who are viewing the recording of this webinar, please use the self-study sheet that's found at the top of the training and webinar page on Child Care Aware of New Hampshire's website. As we leave you this afternoon, we hope this webinar series has helped you navigate through all the information and resources that have been introduced over the past few months. We hope you enjoy the last few weeks of your summer. Fall is coming, but be safe, be well, and thank you for your time and your interest in this webinar series, and enjoy the remainder of your day. Thank you. I'll leave this open for a few more minutes in case somebody had questions or if they had any comments and thoughts they wanted to add into the chat box. Thank you.
Jen, somebody's asking for Donna Lake's email in the chat box. Can you type that in?
Yes, I can.
Thank you.
Oh, I sent it to your panelists. Hold on.
I think you can stop your recording if you want at this time.
There we go.